Hello everyone, Dr. Berk. Delayed ejaculation is just as serious an issue as premature ejaculation. Of course, premature ejaculation is a disease in men. We said it would appear in 60% to 70% of cases. Delayed ejaculation is seen much less frequently. Why do we experience delayed ejaculation, or why can't we ejaculate? How is the diagnosis and treatment of this condition done? I will talk about these. Now, the definition of delayed ejaculation is as follows. It's the inability to ejaculate or ejaculating very late despite sufficient sexual stimulation. This, of course, must create stress and a problem for both the individual and their partner. As I always say, if couples are happy with this situation and it doesn't create any stress, then we can't consider it a disease. Just like with premature ejaculation, there is also a duration for delayed ejaculation. This duration is 6 months. So you have a regular partner for 6 months or more, and if you are experiencing these, then you can really say that you have a reason for delayed ejaculation and that you are experiencing it. Research shows that the average ejaculation time, meaning the duration of the penis inside the vagina, is about 5 to 6 minutes. This, it can extend up to 20 minutes. In general, studies show that after 25 minutes, it has been revealed that both men and women are uncomfortable with this situation and do not want to continue it, and they are complaining about it. With scientific studies, now, delayed ejaculation or delayed orgasm is more common. So, while it appears to be 1.5% under the age of 50, it shows up as 3 to 4% over the age of 50. Why does it increase as we get older? The biggest reason for this is, of course, testosterone. As the testosterone hormone decreases, especially the sensitivity of the skin on the penis also gradually diminishes. Once it starts to decline, we see delayed ejaculation more frequently after the age of 50. Now, we have a certain algorithm like this. We operate according to this algorithm. So, if a person comes in complaining about delayed orgasm or inability to ejaculate, we talk to them, perform a physical examination, but we are trying to find the cause. The most common cause, as seen here, is endocrinopathy, meaning hormonal issues. The most common thing we see among these hormonal issues is low testosterone, especially in older patients. We also have the thyroid gland located in our throat. Underactive thyroid function, a condition we call hypothyroidism, can lead to delayed ejaculation. Mothers have a hormone called prolactin that is released especially after childbirth. We expect this to be high while it is low in men. This high level causes delayed ejaculation. This is high, causes delayed ejaculation. Of course, when we identify these issues and then correct these hormone levels, the situation resolves. The most common cause is this. Another reason is medications. Especially antidepressants and antipsychotic medications used by psychiatrists, as well as substance abusers, particularly chronic alcohol users, those who use marijuana, cocaine, and heroin, also experience delayed ejaculation. Of course, when we stop alcohol use and other substance use, the situation returns to normal. This is the case with antidepressants and antipsychiatric drugs. It's not easy, because sometimes a person really needs to take their medication. Then I will talk about them a little later. We have some medications and we add those. Here, loss of penile sensation is very important. It especially happens in older age, but also in younger people, in those who have had accidents, or in those who have had back surgery. In such cases, there is a loss of penile sensation. We're testing for that. Is there really a loss of penile sensation? Saying, if there is a loss of penile sensation, we have some treatment regimens. By doing these, we can help the person to feel their penis more normally. We can help them feel a lot more. Frequent and incorrect masturbation is also referred to as delayed ejaculation. Actually, it's not frequent masturbation, but rather incorrect masturbation, because some people masturbate in a very forceful way. They are masturbating with a lot of pressure on their penis. Therefore, this pressure, or for example, vibration devices or vibrators are used. Since there is no vagina in this relationship, the person cannot experience the same pleasure and ejaculate due to this pressure and vibration. These are quite important and very common mistakes, especially by young people. I always say this for that reason. I explained this in previous masturbation videos. Masturbate in a way that is appropriate for intercourse, meaning similar to how you would during sex. So definitely, we say to use something oily like baby oil, because the vagina is a slippery, wet place. Not squeezing too much at a slow rhythm is very different from a very fast rhythm. For example, if you're getting used to masturbation at a very fast rhythm, since intercourse can't be this fast, you might not be able to ejaculate because you don't feel the same sensation. This is very important. Incorrect masturbation can also lead to delayed ejaculation. On the contrary, it can also lead to premature ejaculation. Of course, erectile dysfunction can also lead to delayed ejaculation. On the contrary, it can also lead to premature ejaculation. He can do both. Because if a man has issues with erection, when he enters, he might think, oh no, my hardness is going to go away. He might think, I just want to ejaculate as soon as possible. While thinking about getting an erection, he might lose his concentration and not be able to ejaculate. Therefore, if there is erectile dysfunction, it definitely needs to be treated. Psychological reasons are quite important. I think I see it very often, psychological reasons. This is exactly like an erectile dysfunction and premature ejaculation. It's very simple to distinguish this. If a person can easily ejaculate through masturbation but can't during intercourse, there is a reason for that. This could be a psychological reason. Or if sometimes with the same partner he ejaculates very quickly but other times he can't. Or with different partners he ejaculates very well with one partner. But if he can't ejaculate the next day either, that falls under psychological reasons. And here sexual therapists must definitely get involved for treatment. Now, of course, after these are treated, if the situation hasn't improved yet, then we have some medications available. But let me say, this about medications. The preventer of delayed ejaculation is produced just for that purpose. No meds. What does that mean? For example, we have medications for erectile dysfunction. It's specifically produced for that. We do have medications specifically designed for premature ejaculation, but we don't have any medications made for delayed ejaculation. We use the side effects of other medications. What does that mean? You definitely can't use these medications on your own. You need to use it under a doctor's supervision. Otherwise, you might have another condition. You could make it much worse. What are these medications? Here we can use all the medications I've mentioned. Especially at the top of the list is this propion medication. We use this very frequently. But of course, as I mentioned, this is an active ingredient. The brand name is different. I can't give that from there. This is prohibited, but since all these drugs are used for other reasons, please do not take them alone. If you have problems with delayed ejaculation or ejaculation, definitely consult a doctor and get this resolved. Because the solution is actually really easy. Exactly, just like with premature ejaculation, as I mentioned, the treatment for delayed ejaculation can also be done very easily. Thank you.